I'm going to pause recording. Okay, I think I'll go ahead and get started. Um, Again, as we normally do, season 8. We want to welcome you to season 8. Today is episode 11 of Environmental Fridays. It is personal, and this is a nice shot, a photo gallery of our speakers for the 8th season. So today you will hear from Spence Adams. He's right here, Spence Adams. And you'll hear more about him. He'll be introduced shortly. We want to give a shout out to our partners. So the ACS committee, ACS stands for the American Chemical Society, the largest single discipline organization, professional organization in the world, to which I belong as a chemist. So they are in partnership with us, Environmental Fridays. So is a long-standing partnership, friendship with Benton Spirit Community Newspaper, which is in its 23rd, I believe, 23rd year of operation. I serve as editor, and our boss, the founding publisher, is Princella Tobias. You could check it out at www.bentonspiritnews.com. So we are very grateful for partnership with the Benton Spirit and with Princella. Also a partnership with my sister, just straight up, full transparency. She is the founding president of GC Scored, Every Piece Matters. And again, you could access her website at everypiecematters.com. So we are grateful and thankful for the support and partnership. If you want to join us on our Facebook group, in our Facebook group, you simply go to Google um, and Google Environmental Fridays Facebook group, and you'll get the URL showing up immediately. Same thing with our YouTube playlist. We have your YouTube playlist for every season, for all 8 seasons. But for this particular season, season 8, this is the link to season 8 as well as the QR code for season 8. So you could check out some of our past episodes. Very, very informative episodes. And so for the rest of this month of March, you could see we've already gone through 2 episodes: urban green homes, healthcare, waste management. Today we will hear from Spence Adams. Next week, Friday, we will hear about the future of sustainable energy from Annie Kritcher at from the Lawrence Livermore National Laboratory. So some very impressive topics and experience and expert uh, speakers. For the month of March, which we are pretty much at the end of already, today, in fact, is International Day of Forest. I believe that to be something promoted and put on by the United Nations. And then tomorrow is World Water Day. So you could go again to Google, put in these phrases: International Day of Forests, World Water Day, and you'll get a whole lot more information about those 2 observances. So today I have the honor. This is the second time Lily has been a co-host for us. She's a graduate of Andrews University, and she didn't waste a whole lot of time. She triple majored in English, literature, Spanish, and behavioral science with a concentration in anthropology. She's made several trips. For example, while she was a student here, I believe, for example, conducted research in historical economics of Jordan, archaeology, sustainable tourism in Iceland, permaculture in Southwest Michigan. Um, Lily, you got to tell me some more about this permaculture in Southwest because we like to have them on. And she studied abroad in Spain, did archaeological work in Jordan, did a travel guide for Iceland. So Lily has gotten around. She's currently, have you started that role yet as children's librarian in
No,
Canada?
I start that in about 2 weeks, so that's exciting.
You're 2 weeks into it?
No, I'm gonna start in 2 weeks.
In 2 weeks, okay.
Yeah.
So it's good again to have you on here. I think we first really met and interacted with each other. I believe I wrote an article for
For the newspaper, I think it was.
Student
Yeah.
Movement, and you were
Yeah.
one of the editors or something like that,
Yeah.
I think.
Yeah.
Anyway,
A while
so
ago.
yes, so thank you for coming on as a co-host.
It
And
is
you,
such an honor. Thank you. Mhm.
yes, you can go ahead now and introduce our speaker for today.
Yeah. So it is such an honor to be here. And I want to thank you, Dr. Murray, for organizing this. And it is my absolute honor and pleasure to introduce Spence Adams. So Spence Adams is the Michigan Department of Health and Human Services Environmental Health Bureau Community Engagement Coordinator for the Region 5. His work with Allegan, Berry, Berrien, Calhoun, Kalamazoo, Branch, St. Joseph, and Van Buren Cass counties. His work includes finding community champions to disseminate information to the public equitably. He discusses topics such as lead, PFAS, water safety, municipal water systems, much more. He joined MDHHS EHB, which is that Department of Health and Human Services Environmental Health Bureau Community, in October of 2023. He holds a bachelor's in public health and is a certified health education specialist. He's graduating with his master's in public health in December 2025 from Western Michigan University. All right, the time is now yours.
All right.
Awesome. Well, thank you so much for having me. It's a pleasure to be here. And I'm going to set up real quick with a PowerPoint.
Mhm.
Give me just a minute.
No problem.
To the top. All right. Can everyone see this okay?
Yes, it's all
Great.
good. Yep, all good.
Okay, so thank you. And also, I can't see you. So if you have something to say, please come off mute. While I'm in presentation mode, I can't really see everybody. So please come off mute if you have anything that you would like me to elaborate on more or discuss. But it's great to be here. Super excited to be here. Thank you for your time. So, as you heard, my name is Spence Adams. I am the community engagement coordinator for Region 5, which is Southwest Michigan, which included all of the counties that were read out to you before. And I my role as a regional community engagement coordinator is to raise awareness and find opportunities to teach and share our public health recommendations. We partner with local health department officials and community organizations to assist in proactively providing awareness and education to the entire community. So it's really important to me that I partner with trusted organizations throughout different communities in order to disseminate information on environmental health. This is where we like to do, where we meet people where they are instead of having them come to us. So they're able to get information from places that they trust and they're able to better make choices for what they need to do in the future. So this is our agenda. I'm going to tell you a little bit about us, and then I'm going to go through an overview of the environmental health assistance that we offer, and then chat about community education, outreach, and engagement support. We will be chatting about asthma and mold toward the end of this presentation, but this is just a basic agenda of what we're going to be doing today together. So about us, the Environmental Health Bureau is part of a larger department of MDHHS, which stands for Michigan Department of Health and Human Services. We in EHB work specifically to promote and protect the health of Michiganders by educating residents on environmental hazards that can be found in our air, food, soil, water, community, home, and workplace. The Bureau is supported by toxicologists, epidemiologists, health educators, engineers, geologists, and project specialists who lead their expertise to our programs throughout the Bureau. So this is our framework. The Bureau utilizes what we call the 3 I's: identify, investigate, and intervene. We use this model to identify exposures and then investigate related health effects on those exposures, and then we intervene with public health actions. New areas of concerns or gaps in resources and education are constantly being identified, and our Bureau helps to fill those gaps with awareness and education. Through our education, the vision and hope is that we can end or prevent injury from environmental, chemical, and physical hazards and promote equity for all Michiganders. So these are the things that we're going to be talking about. These are all the programs that the Environmental Health Bureau has to offer. And we're going to go through each one to just get a little bit of a look at see what they mean and what they do. The Bureau has several environmental health assistant resources to address exposure to health hazards from all environmental sources, including air, food, soil, and the workplace. We also have sources for one's community home and drinking water. As liaisons between MDHHS, EHB, and local organizations, we strive to work with regional collaborators to supplement ongoing local efforts to promote and protect the health of the community. We also hope to identify opportunities to engage the community and local organizations in relevant EHB programs. We create opportunities for the community and local organizations to provide feedback and local EHB initiatives. We keep communities updated about emerging EHB resources and opportunities. And lastly, we communicate local environmental emergencies and work with local partners to coordinate response. So let's talk about our health education. We have a health education team that creates our messaging. The topics we cover are often complex and hard to understand. As a health educator, their role is to take the complex information and transform it into something understandable. We have a variety of tools that we have created to help share our public health messaging through educational materials. Each program has available materials that discern concerns, which why it's a concern for health, and actions residents can take to reduce their potential health risk. So this is one of our, this is one example of how we share information with the residents. It's called Badge for Better Health. So I'm going to play this just so you can get a quick glimpse of one of the ways we reach our residents.
Be an advocate for environmental health, a protector of your family.
It's hazardous. It does not go down the sink.
And the things around you. Because our health is connected to our environment, let's work together and make healthier choices for a healthier future. Get started at michigan.gov/envirohealth.
So yeah, that was just a quick video of the things that we teach and educate those organizations and community members on so that they can be better stewards of the earth and also know how to prevent risk. We do a lot of community outreach as well. We also have community outreach technicians who are working to find opportunities to be present within communities. The concept of meeting people where they are stems from generally caring about people and creating a mutual relationship. It is about going to the places people love, trust, and frequently visit rather than expecting them to come to us for information. This is an opportunity for EHB to build relationships with residents and show we are here for them and want to ensure the best quality of health. Community outreach staff look to build long-term relationships with our organization for continued engagement and the community members. We do language access as well. So there are multiple resources that we have in multiple languages. In Southwest Michigan, we primarily do English, Spanish, and Arabic, but we have other linguistic support for other languages as well. So here again are all of the topics that we're going to go through in this presentation. These are all of the responses that we do. And this is going to be how we're going to break up the presentation. So environmental health threats response. If you're in Southwest Michigan and if you remembered the Pfizer spill or any type of spill into our waterways, this is the environmental health threats response. Many of our sections and programs operate in a response capacity. In addition to day-to-day responsibilities, when an environmental health threat is reported, such as an oil spill or release of hazardous chemicals, we respond to their situation by mobilizing the appropriate sections and staff. Our response includes evaluation of site-specific chemical contamination. So we identify the chemicals present, review scientific literature, evaluate potential links between chemical and health risks based on screening levels, recommend actions to reduce or stop exposure to protect health. We also do epidemiology. This is the deployment of tools, strategies, analyze real-time data, design research, and also perform evaluation. We do environmental and biological sampling. So sample collection and data analysis methods such as drinking water. And we do environmental health navigator program, which is a one-on-one engagement with residents, and community engagement and outreach, which is the development of public health education materials, community-wide distribution of materials and messaging, and building, maintaining community partner relationships to build and trust in the community. This is our lead exposure prevention assistance. EHB has several programs in place to prevent and respond to exposures from lead from drinking water and other household and environmental sources like paint and soil. Our lead exposure prevention assistance aims to identifying vulnerable communities and providing proactive support to reduce and prevent the impact of lead exposures, especially for children. This program combines the services from several sections of EHB to best serve the communities with the greatest need across the state. The Lead Safe Home program offers qualifying families a home environment lead inspection to identify and remove lead hazards from homes, including that from lead paint, plumbing, dust, or soil. If identified, these households are able to be in a queue for abatement services. Additionally, we work with the local health department staff to promote blood lead testing and provide needed health services, education, and outreach. My Lead Safe website has the resources for individuals concerned about their lead or about lead in their home or drinking water, and resources for healthcare providers. So what is new is under Michigan's law, it's now doing universal blood lead testing for children. It is required that doctors offer blood lead testing at age 1 and 2 or before age 6 if a child has never been tested for lead. Additionally, children must be tested at age 4 if they live in a geographic area identified by MDHHS as high risk for lead poisoning. It is important to note that parents can choose to not have their child blood tested for lead. However, it's highly recommended. So this is an emerging topic. It is our PFAS response. PFAS contamination has been a topic of much interest in the state of Michigan and across the country for the past several years. PFAS, which is per and polyfluoroalkyl substances, are human-made chemicals that repel oil, stains, grease, and water. They are used in fast food wrappers, stain repellents, waterproof clothing and shoes, and many other consumer products. Most people are usually exposed to PFAS by swallowing them. This can happen by drinking water or eating food that is contaminated with PFAS. You can also be exposed by handling household items that have PFAS in them. EHB is part of the Michigan PFAS Action Response Team, also known as MPART, which is a collaboration between all the state agencies who investigate sources and locations of PFAS and protect drinking water and public health. At sites of possible PFAS contamination, state toxicologists work with individuals within EHB and other state agencies to assess the risk of exposures to PFAS, providing a written public health assessment that makes public health recommendations about the exposure. Recommendations may include DHHS providing PFAS certified filters through local public health departments for affected residents, or may involve MDHHS resampling their drinking water. This free resampling at selected homes near known or suspected PFAS sites is designed to monitor changes in PFAS levels and determine if there is a new public health recommendation or filtration recommendation for the area. MPART has worked with Eagle, DNR, MDARD, MDHHS, and others to sample a variety of media for PFAS levels across the state, including all community water supplies, residential drinking water wells near areas of known or suspected PFAS contamination, soil in areas of suspected PFAS contamination, biosolids, deer, fish, cattle, surface water. The PFAS response website provides additional information and PFAS resources. So these are our research projects and health studies. They're spread all throughout the state, and it's dependent on where you live if you can participate in any of these studies. We currently have multiple biomonitoring research projects and health studies underway. These projects will help us learn about our exposures, our environment, and our health. There are 3 types of projects in DEH Bio, which is biomonitoring, exposure assessments, and health studies. The information gathered from these projects can be used to help recommend changes to public health policies and better protect communities that may be at greater risk for exposure. PFOAM's project is a statewide initiative with the primary goal of determining blood concentrations of PFAS in Michigan firefighters. My Chem project is the first statewide effort to gather data on the amount of certain chemicals in the blood and urine of Michiganders including lead, mercury, and PFAS. The Michigan PFAS Exposure and Health Study, or MIPES, is one of the most comprehensive and cutting-edge investigations into the health effects of PFAS exposure being conducted in the country. MIPES is a large longitudinal or long-term study designed to examine the health of Michiganders with past exposure to PFAS in their drinking water. MIPES has 3 phases. Phase 1 was 2020 to 2021. Phase 2 was 2023. And Phase 3 is now 2025. MSS is a study funded by the Center of Disease Control and Prevention, or the CDC, for toxic substances and disease registry, so ASTR, in 7 states across the United States. It is partnered with MDHHS to conduct MSS in the city of Parchment and Cooper Township and Kalamazoo, and Belmont and Rockford area in Kent County. There is also the PFAS exposure and antibody response of COVID-19 vaccine study. The Michigan Department of Health and Human Services conducted a research study to see if PFAS exposure affects how the immune system responds to COVID-19 vaccines, including antibody production. So all of that is a lot, but if you're interested in the health studies and biomonitoring projects that we have, you can definitely go to the website provided down below and look at the health studies that we have currently available. Eat Safe Fish is one of our most popular programs. This program provides consumption guidelines for fish based on level of hazardous chemicals measured in fillets. Chemical compounds that cause consumption guidelines include mercury, PCBs, dioxins, PFAS, and pesticides. The guidelines are designed to be protective of everyone who eats fish, including children, people who are pregnant or breastfeeding, and people with pre-existing conditions like cancer or diabetes. The Eat Safe Fish guidelines are water body specific and species specific. So they differ from water body to water body and among fish species in the same water body. These guidelines include recommendations for choosing and eating safer fish, as well as preparing fish in a manner that limits exposure to chemicals. Eat Safe Fish also issues statewide fish consumption guidelines that apply to fish from water bodies that have not been tested. These guidelines are mostly due to mercury, which is found in fish in Michigan and across the United States. Eat Safe Fish also issues consumption guidelines for wild game from other areas. One way the program gets information out to the public will be with the River Walker program, first launched in Saginaw area and now running in Detroit, the Kalamazoo River watershed, and the Huron River watershed. The River Walker program provides information directly to anglers fishing the shoreline who are likely to be impacted by environmental contamination. This is done by River Walker staff who are typically members of the community that are hired by MDHHS and trained on the Eat Safe Fish messaging about the best methods for choosing, eating, and preparing fish to limit exposure to chemicals. Eat Safe Fish shares its guidelines online at michigan.gov Eat Safe Fish through Eat Safe Fish regional guides. So we have the Upper Peninsula, Northwest, Northeast, Southeast, and Southwest in the Lower Peninsula, which lists all current fish consumption guidelines for that region. Environmental health and healthcare for providers. We know that doctors, nurses, and other healthcare providers don't receive much education on environmental health topics during training, but environmental health has such a large impact on health in individuals and communities. The Environmental Health for Healthcare Providers program is aimed at increasing connection and alignment between public health and healthcare providing support and incorporating environmental health into patient care. and increasing healthcare provider knowledge on environmental hazards. On the program website, there are curated practice-relevant resources for providers on topics like PFAS and lead, patient-facing resources, links to environmental health data like My Tracking, and resources to share health data to busy providers like lead data briefs, which you can see in the bottom right corner. Care for My Drinking Water. So Care for My Drinking Water program was developed to fill existing gaps in knowledge and behaviors related to drinking water. Three main goals of this program is goal 1 is aimed at all Michigan residents, striving to educate Michigan residents about where their drinking water comes from and what the best practices are to protect their health. Goal 2 is aimed at private residential well owners. We aim to improve awareness about the importance of private well maintenance to protect drinking water quality. And goal 3 is aimed at public water supply customers, primarily improving awareness about where people can find information about their drinking water quality, whether that be from a CCR or from their landlord. So this is some of the programming that we have for the My Drinking Water program. We have a lot of things targeted at children as well, such as a bracelet making kit, an Enviroscape, stickers, youth activity booklets. We have a couple of books. One's called Why Water's Worth It, just so we can start that process early and get them thinking about where water comes from and why it's important. The Michigan Climate and Health Adaptation Program. The mission of the Michigan Climate and Health Adaptation Program is to investigate climate-driven health risks, identify information for decision-making across sectors, and promote the implementation of climate adaptation strategies in Michigan communities. One way the program has carried out this mission is through the development of the Climate and Health Adaptation Planning Guide for Michigan communities. This resource is intended to use in Health in All Policies approach to help communities develop a climate adaptation plan or integrate climate concepts into existing initiatives. A climate and health adaptation plan is defined here as a strategy document that fosters collaboration across disciplines and interest groups to investigate a series of activities towards the common objective of understanding and then preventing or reducing the anticipated health impact of climate change in the area. We also offer across our access to the Michigan Climate and Health Profile Report, which provides Michigan data-based information about climate effects on health, including extreme heat, Michigan's vulnerability to climate change, and Michigan's current and future climate conditions. Additionally, we have health education materials and fact sheets on extreme heat and cold safety for health. Finally, by providing technical assistance to state and local partners, including community-based organizations, municipalities, and local health departments, several evaluation and health impact assessments have been completed across the state to assess impacts of climate-driven events or climate adaptation strategies on human health outcomes. My Tracking is to help fill the knowledge gap about environmental health or environmental hazards and public health. The My Tracking program was developed to gather existing Michigan-specific environmental, population, and health data and provide them in one online resource. Harmful algal blooms or HABs. These appear everywhere, and they appear in Michigan water bodies for recreation, and they're algal blooms that contain cyanobacteria. There are different types of naturally occurring algal blooms that may be seen on lakes and rivers, and most are not harmful. However, there are some that contain cyanobacteria that have the ability to produce toxins that can make humans and animals sick. These algal blooms are known as HABs. Over the past decade, the number of cyanobacterial blooms reported to state and local agencies in Michigan has increased each year. HABs may affect surface water that people use for recreation or drinking. As part of the HABs program, we and other state agencies can provide technical assistance in identifying and testing harmful algal blooms and water, conduct risk assessment, and provide risk communication messaging and track HABs question reports and associated illnesses. Next, we have mercury and health. Mercury exists in various forms, and people are exposed to each in different ways. The most common way people in the United States are exposed to mercury is by eating fish containing mercury. Other exposures may result from using or breaking products containing elemental mercury, such as silver liquid that can release of invisible vapor. Mercury can be harmful to your health, but it is especially harmful to the health of children and unborn babies. If liquid mercury spills, call the MDHHS hotline to report it. The program can respond to several aspects of the mercury spill, including consultation and screening. We also provide health education materials online. You can learn about exposure in fish through our Eat Safe Fish program. And we have resources for homeowners and responders about mercury spills. The sale of mercury fever thermometers have been banned in Michigan since 2003, and still the most common spill reported in the home is found from fever thermometers. So we promote mercury disposal, helping individuals to locate nearby household hazardous waste collection events and disposal centers so that mercury-containing items can be properly disposed of before they break. So next we're going to talk about asthma and mold. So I'm going to stop sharing for a minute. Okay, can everyone see my screen still?
Yep, looks
Yes.
Great, great. Okay. So I want to talk about asthma. This is from our My Tracking our website that you can find on our website, which is www.michigan.gov/envirohealth. So first, let's talk about what is asthma. So asthma is a serious lifelong disease that is caused by inflammation in the airways that carry oxygen in and out of the lungs. Asthma, unfortunately, cannot be cured, but symptoms can be prevented and controlled by staying away from what is known as triggers. We can control these symptoms by using medications right away. People with asthma can live normal, active lives, and they can enjoy indoor and outdoor spaces so long as they understand what their triggers are and how to control them. Some symptoms of asthma include coughing, shortness of breath, wheezing, and tightness or heaviness in your chest. Emergency signs are being very short of breath. Quick release medications are not helping. Peak flow is less than 50% of your best peak flow, where you notice your lips or fingernails are turning blue. If you suspect that you have any of these symptoms, we recommend that you talk to your primary care provider to discuss the possibility of having asthma. Doctor's visits. It's important if you do have asthma that you keep your doctor's visits or reschedule if necessary. You ask your doctor what you need to do to control your asthma, and you ask about long-term control medications to prevent your symptoms. Take your asthma medications as prescribed. Take long-term control medications every day. Know that long-term control medications will not give you quick relief from asthma symptoms in an emergency situation. And make an asthma action plan with your doctor and follow it. And if you are confused about your case, ask your doctor to repeat the information in a different way or write it down for you. Don't agree to do something that you don't plan to do or can't do. Ask if there are any other options. Now, asthma triggers are very personalized and come in a variety of things, but the most common are changes in weather, chemical fumes, gases, dust, animal protein, or other substances breathed in while at work, cigarette and wood smoke, dogs, cats, birds, and small rodents, emotional states that can lead to hyperventilation, exercise, house dust mites and cockroaches, mold, outdoor air pollution, especially on days when there are high levels of ozone and particulate pollution, pollen, scented products such as air fresheners, hair products, cosmetics, and cleaners, some foods and food additives. So when it comes to asthma, the most important thing is to know what your triggers are. When you know your triggers, you're able to avoid them to prevent any type of crisis. But if you do fall into a crisis, it's important to take your medication as prescribed by your doctor. And if that is not helping, then go to your doctor or ER immediately. Mold, as I said, is one of the common triggers that we're going to talk about next when it comes to asthma. Um, it's found in many places, any wet environment, usually found in basements of homes. And it's going to trigger asthma for children and adults alike. So mold is a living thing. It has tiny spores or seeds that are always in the air, indoors and outside. The spores are so small that you can't see them without a microscope. Most of the time, the spores land on something dry and nothing happens. They get sucked up by your vacuum or wiped away when you dust. But if the spores land on something wet, they can begin to grow into mold that you can see. So how do I know if mold is growing in my house? You cannot see mold spores because they are too small, but once the mold starts to grow, you will notice it. Mold can grow on almost anything as long as there is a little bit of water for a couple of days. The growing mold can be different colors: white, gray, brown, black, yellow, orange, or green. It can be fluffy, hairy, smooth, or flat and cracked like leather. Even if you can't see the mold, you will be able to smell it. Mold can smell very musty, like old boots or wet dirt. When should I hire someone to test for mold in my home? Having someone test for mold in your home costs a lot of money and is not really useful. You can probably find the mold just using your eyes and your nose. Look in places that you know are often wet or damp, like bathrooms or the kitchen, or that have been wet because of leaks, floods, or broken pipes. If you have mold, you will probably find it in those areas. So here's a diagram of the common places that mold can be found. We got the attic. If there is dirty laundry or a broken windowsill, it can be around window frames. It can be in the kitchen because of cooking. If there's a broken pipe in the bathroom, plants, if they're leaking, water can cause mold, and also in the basement due to pipes. So what happens if I find mold? How can I clean it up myself? If the mold is growing on something that can be cleaned with bleach and water, and you do not have asthma, so that's key, or other health problems, you can probably clean the mold yourself. If the area that is moldy is very large or you have health problems, you might want to hire a contractor to do the work for you. If you decide to clean the mold yourself, please read the MDHHS Steps for Cleaning Mold fact sheet before you start. When it comes to hiring a contractor, you do not need to hire a special mold remediator Regular home contractors can remove the mold and repair any damage caused by it. Look in your phone book or ask friends for a good home contractor in your area. The state of Michigan does not certify or license companies for mold cleanup. The Michigan Department of Health and Human Services cannot recommend any companies to do the work. And what if I think I have toxic black mold? While stories about toxic mold have been on TV a lot, black mold is not worse than any other type of mold that you may find in your house. According to the CDC, the term toxic mold is not really correct. While certain molds are toxigenic, meaning they can produce poisons, the mold itself are not toxic or poisonous. You do not need to test your mold to find out if it's quote unquote toxic mold. Just clean it up like you would any other kind of mold. And then how do I stop mold from growing in my house? For mold to grow, the spores need 1 to 2 days of dampness in order to be put down roots. If you discover a leak or a large spill, dry the area right away using towels and soak up as much water as possible. Then use a fan, if you have one, to blow air over the area to dry it completely. Here are some things you can do. Always use a vent fan for your stove or when cooking. Turn on the vent fan in your bathroom when taking a shower. If you have a damp basement or live in a basement apartment, use a dehumidifier. So those are just some things about mold, and those are some things about asthma. That is all I have for my presentation today. Does anyone have any questions?
You had a lot. So that is all you had is like an understatement. Lily, you want to start us off?
Yeah, I can just get us started on the questions. So I see that you guys have so many initiatives or projects going on. I wanted to know if you guys collaborate with any other government departments, like, because I know that you collaborate with organizations, but what are some of the most common collaborations you do with other parts of the government?
Yeah, so we do have a lot of projects, we do have a lot of programs, and we collaborate with a lot of different people, including MDARD or DNR. We also collaborate with, for example, the PFAS part. We are part of MPART, which is Michigan PFAS Response, and we collaborate with Eagle on that. So there's a lot of moving parts that we work with. Local health departments are a big one that we collaborate with as well, just to get our information out. So there's a lot of moving parts, but we collaborate with many different people depending on what
Yeah, I bet. I bet. Yeah,
yeah.
so then my second question kind of was like, where does the funding for all these projects come from? Is that mostly taxpayer, or is it also like from private sector funding?
So it's mostly taxpayer, yeah, and it's from grant either like CDC grants or NIH grants or things like that. So it's mostly taxpayer and things like that.
Yeah. And then my last question would be, and this might be a really hard one to answer, but with the recent just changes in the way government funding is working, which who knows what it'll even be tomorrow, can you make any predictions on like how that could affect your operations?
So
Because
we
CDC
are,
grants or NIH. Yeah, go ahead.
yeah, so most of our projects are state funded. So it really, like you said, the landscape can change tomorrow. It as of now, we're in a good spot, but things can change. We believe that we have a strong enough position to where we can fight for our funding, especially with just the emergence of environmental health concerns of the country. But who knows?
Mhm.
That's true. All right. Thank you so much for this presentation. That's all my questions. But it seems like some of the people in the chat had some questions, such as Rena.
Rena?
Thank you so much. Um, wow, this was really amazing. A lot of great information. Sorry, I'm not feeling that well, so I'm so glad for things like Zoom. But I'm located in the Lansing area. I own the New Citizens Press since 2002. And I'm very shocked that I have not heard of most of this information, especially the information that could be handed out. You were speaking about um, booklets and coloring books and things that you can give out to children. And most of the time, we're going to schools and we could hand those things out while we're doing speaking engagements. I'm wondering if we could get a list of the other people who do the same thing as you, but in different areas. Like I said, I'm in Lansing, so that's different from Benton Harbor area. Also, would like to know how the media could help disseminate some of this information, which seems to be very, you know, uh, very simple in the way that it was explained today. It seems like it's something that's very simple to be able to disseminate to others so that they have this information. I'm I'm kind of blown away that I have not heard about almost any of these programs, with the exception of PFAFs, because we have Alyssa Slotkin that was working on PFAFs for a very long time, but everything else I had no clue. So, how do we get to inquire about partnering with the agency to disseminate some of this information after my long-winded speech?
Yeah, so we have regional coordinators in all regions of Michigan. So Lansing, looking at my map now to see who that is. Um, are you, sorry, I'm originally from Atlanta, so I'm not really familiar with the location.
I think I'm region one. I got a good I'm to the right of your
Oh,
region, which I
okay,
think
yeah,
is
yeah.
why.
Yeah, so that would be Ashley Mark. So what I can do is I can either put her email in the chat or I can take your email, whichever you prefer, and I can connect you that way.
Either way is fine with me. I'll put my email in the chat right now.
Okay.
And as a follow-up, is this information on your website? The
Yes.
region, yeah, the regional coordinators. Okay.
As a second follow-up, I would like to just add, thank you, Rena, for that question. As I wear one hat, which is media, and we've been here since 2002 as well, and in Benton Harbor, Michigan, we were very instrumental when we had a crisis, and that was our water and lead crisis. But when you start thinking about some of the things that you mentioned, and I'll put on another hat later, it is critical. So during the water and lead, we were fortunate as a newspaper to be an outreach tool. And so I don't know what region actually we would be in for Benton Harbor, but I would like to know and who that coordinator is. But how can we be intentional? And I say that because my area and one of my heartfelt issues now or areas is asthma. But how do we start being proactive? But proactive is still in Benton Harbor in our county of Berrien, where we got 25% of Black adults. And I think that number is very low, as we've been working with 3 years with asthma, that have been diagnosed already with asthma. How do we start being more preventive? And what can we do as media and in our respective communities and being helping the state get the word out via media? I don't think we can use the word anymore, environmental justice, but we are an environmental justice community. So on the media side, what can we do? Can we work with our coordinator and share with us later who that coordinator is for Benton Harbor, Michigan, for Berrien County?
Yeah. So I am the coordinator.
Yeah.
Oh,
Yeah. For
yay!
Berrien. Yeah, and there's a lot that we can definitely discuss. We do a lot in Mitten Harbor right now. We do a lot of like food drives, and we go to the local health department a lot. And during the water crisis, we supplement information and things like that. But for the media, we can talk about how we can give you some of the information that we have and you can disseminate that way. And we can talk about whether or not it'll be beneficial to have some type of event with you. Things like that are all ways that we can collaborate. Um, I would love if you put your email in the chat and I can follow up with you on more things or show you at least some of the information that we have to see if you would like to include that in any of your media. But I am Region 5, or Berrien County is in Region 5, and I am the coordinator for that region.
Wonderful, wonderful.
So,
And that's great. But as a small newspaper business that's making a tremendous step in our community, I would just like to say that we'll take your information, but I think the state needs to be more intentional and look at some of your outreach funding to help us from an economic development standpoint, to help us about being intentional, to be certain that you're reaching people. I mean, I wish our paper was large enough and we were, established, and we are because we're doing tremendous things, print and online. But I would just like to talk to you later about being intentional and utilizing your education and outreach funds for some of these programs.
so
Absolutely.
as a quick follow-up with specificity, we currently, I'm the editor for the Benton Spirit community newspaper. So Princella is my boss. So we do have an environmental page. So what I'd like to propose, and we could discuss it offline in more detail, is that we publish every 2 weeks.
Well, let's talk about it offline if you don't mind.
Right. But I'd like us to talk about having regular information from EHB to be included into that environmental page.
And even equally as important is our deadline that's coming up for May, Asthma Awareness Month. So we can talk about that as well. This will be our second annual. It was very successful the first year, and we're touching lives and saving lives. And this event is important. So we can talk about that offline as well.
Mm-hmm.
But I would like for people on this call to know, come to Benton Harbor. We haven't confirmed the date yet. It would be the 22nd or the 29th. We're waiting to hear from the venue, but we'll keep everyone abreast about that.
Okay. Mary Alice?
Thank you. Thank you very much. I'm sorry I've been missing this, but I've been in a lot of meetings and I should be able to answer a lot of the things that I've heard because we're still capacity building amongst organizations partnering, because it's going to take all of us to work together. And Spence, thank you. And I really love to have your information. I'm not sure if you're affiliated or connected with Midwest Decarbonization Coalition. There's some funders that are waiting for this fund. They demanding actually that we keep the work moving and get this money out into this work. And anybody and everybody and however many bodies that want, or any organizations that want to apply for the funding, it doesn't matter if they overlap. Anybody can apply for as many times as you want. A different organization that may be working together or for different things or the same thing. They want this money moving while they have access to it. And there are 3 tiers that are going on right now that you can apply for. Actually, if there are 2 or 3 organizations, each one can apply for the same grant. See, some people are just so misinformed that we meeting. I'm tired of just meeting just to be meeting. There's some things that are moving. There's some actual ships that are moving. Rena, I would suggest you please contact One Love Global in Lansing. They will give you a lot of the information that was talked about here today. And they happen to be in Lansing. And we are steadily looking for partners like the ones on this line. because we are Region 5 and it consists of about 8 states. And there's some jobs that are available to do exactly what you're doing, Spence, but they happen to be in the Detroit area. That's why I asked in the chat, was it anybody from Detroit? This information just came down yesterday or the day before, and there's some very good opportunities for some that have been doing this work to actually apply for a job, because this work is not easy. And we need to be looking out for one another. This is not an I or a Mary Alice thing. This stuff is serious. And we have some people in place that are trying to dismantle the very democracy that we're fighting to keep. Right now, there's a convening that's about to happen in Rochester, New York. I wish I could be there on the 27th, talking about all about water. And Freshwater Future are some real water warriors. And they not only look out for when we look out for the water, we're looking out for air and everything else. Please Google them.
Okay. So, Spence, and you mentioned in your talk a couple of areas. One is the lead high-risk areas, and the other was known PFAS sites. Are those lists something that you could give us? Because it would be very good to have people in those areas be aware of the risk involved both with the lead as well as PFAS.
Absolutely. And that is something that's found on our website as well, which is michigan.gov/envirohealth. And there's a list of, they're called faucet filter safety net or filter safety net communities.
Okay.
It's all a part of our initiative called Get Ahead of Lead. And there's communities throughout the state that are at high risk. And we target those communities with education, with filters, with things like that, in order to make sure that they're able to get the assistance they need. I can contact you and show you how to get that information, as well as PFAS. It's also on our website too, and show
Okay.
you how to get that information
Right.
on off our website. And I can also talk about the filter safety net communities as well.
Okay, very good. Other comments and questions? While you were talking about mold, I went online and found that vinegar is actually something that's recommended for cleaning mold. And in some cases, it says to a combination of vinegar with baking powder, and then also hydrogen peroxide could be used to kill mold and mildew. So I think that's reliable information, but what do you have to say about that?
So we recommend bleach.
Mm-hmm.
I'm not saying that there isn't other things out there.
Mm-hmm.
I'm looking at our mold website right now, and it says steps for cleaning mold. There's another page we have. Um, it says, or what we recommend is household bleach.
Okay. All right.
But again, I'm not saying that there aren't other ways. That's just what the state recommends.
Right. I understand.
And I can put that in the chat to the website.
Okay. Pat from Trinidad.
Yes, this is absolutely incredible. It is so good to see the amount of detail and what this is going on. This is kind of anyway, thank you very much indeed.
Do we have that in Trinidad? Does our
well, absolutely not.
This is an advocate for, this should be an advocate for having a separate ministry of environmental health.
We've been trying that for years. We had a minister of the environment for one short period of time. Anyway, but don't let's get into that because we're now in election silly season.
I know.
We now have an election coming up.
Yeah.
But it's a different sort of question. In Trinidad and Tobago, we have a distrust. I think it's a natural distrust for our water supply that comes out of our taps. There's no way of us being able to check the quality of our water. The net result of that is that a lot of people use single-use plastic bottles, and they wander around with these single-use plastic bottles. They discard them, and that becomes a major source of our waste. And it's these plastic bottles become a source of food for marine animals, etc. And you can imagine what happens then when a jellyfish decides that when somebody decides, one of them decides that jellyfish is a plastic bottle, is a jellyfish, and they busy eat it. So a plastic bottle, or even worse yet, a plastic bag. So right now, getting round to the question, do people go wandering around with single-use plastic bottles all the time in Michigan? Yes. See somebody nodding. So it is a problem worldwide. It's not just Trinidad. When you go to other countries, and I kind of see in other countries people don't wander around with their own bottles because they can go to the nearest tap in public areas. There are water fountains, and you can actually use them.
Yeah.
So I suppose that is my question. And I think I've had a few answers already. People do use still a lot of bottled water, and they don't understand the dangers of using bottled water because they contain microplastics, and microplastics are not very good for you. Right. That's enough for now. Thank you very much.
Yeah, thank you for that. And I can't speak for the rest of the world, but definitely in Michigan, I would say that there's also that same distrust for water. And we're working to change that narrative and to fix the water lines and to make sure that there is water for everyone. It's difficult when you have something as major as like the Flint water crisis, for example, that was national news. And that community suffered greatly because of that crisis, for people to gain more trust in municipal water. So we're working to change that narrative. We're working to give safe water to all Michiganders with our local health departments and everything else, just to ensure that people can start to trust the water and then hopefully die down on buying single-use water bottles.
So just another plug for tomorrow, which is March the 22nd. It's World Water Day. So you guys could go online, just use, Google World Water Day. You'll get more information, and they'll probably also give you different suggestions on all aspects of the use of water, treatment of water, and all that sort of thing. So check it out. This conversation was relevant to what will be happening tomorrow around the world. World
So
water.
I have another question about even here. He spoke about well water. And I know a year ago or more, the state was doing free well water testing. Can you tell me where we are? Is that something that's still happening? Will they will come into areas that have well water and test them? Or what can we do to have them tested?
In Berrien County?
Yes, Berrien County, yes.
So we are not doing free testing right now, but if you have a well in Berrien, are you in Benton Harbor City? Are you in or
Township.
Township? Okay. So if you have a well, what we have recommendations on how to check your well, how often to check your well, things like that. But we aren't doing testing for free anymore. We are only doing well water testing for areas that we believe have a high risk of contamination due to what have you. So what I would recommend is contacting the Berrien County Local Health Department and seeing if they are doing any testing in the area for free.
So with that being said, the Benton Charter Township did submit a letter less than a year ago to residents about their water. So would that qualify under that free well testing?
So it depends on, so there's certain criteria that you have to meet in order to get free well testing. One of them is you have to either be on Medicare or Medicaid and have a child in the home under 19 years of age. So you have to follow that, you have to meet that criteria and live in an area that has high well, or not high well, that is high risk. So if you meet that criteria, you can contact the local health department and see if they're still doing free water testing. We're not.
Okay.
So that is just what happened there.
So
Unless I have two other questions, if you don't mind, if no one else has anything. And
I
one
wanted to,
has,
I wanted to follow up, Princess, specifically, does our local health department have an environmental health specialist? Do you know?
Yes.
Oh, okay.
and I
Okay.
just wanted to give a plug out for people who are here in the Benton Harbor, and it could be the Barron County area, but I don't know, is that Barron County Health Department is coming in testing to help people with plumbing. And so that program is active right now. Dawn Poindexter is the contact person, and she's really, really great. She is. So please reach out to her. And I will say that I have a concern there because, again, it goes with what you just stated. It's only if you're on Medicaid or have someone 19 and older. So what happens with people from this safety being safe that you're not on Medicaid? So if you're not on Medicaid, but how do people like that qualify, or how do they get testing, or how do they get plumbing, those same incentives that others are getting because they're on Medicaid?
Yeah, that is an issue. That is an issue that we have run into, and unfortunately, we would love to provide the service for everyone, but unfortunately, we just don't have the funds to do that. So, if they're not on Medicaid and they don't have a child 19 years or under living in the house, the other ways to go about it is to contact, Dawn or Nick at the local health department and see if there's any other like avenues in which they can explore to get their house tested for any lead or get their well tested or get any abatements or anything that they have. Because at the state level, that's the criteria that we just set for.
I would like for you to use that food for thought for some of your next, forums or internal, because this one is just for the city of Benton Harbor, so I can clarify that. But I think it is essential if there is parents, so is it an in or for the 19 and younger? Because if there are parents who are both working, I think safety should be the priority. And it shouldn't be if you're on Medicaid. So that's just food for thought for some of your internal. But my other question is, is your department, or what department is collecting data? Because I think that's so essential that we know who to go to for certain data. Let it be mold, asthma, lead. Where can we go from a state perspective to know about the data of these environmental health issues?
Yeah, let me put that in the chat.
Thank you.
And but didn't he also talk about the research projects and sites that you guys have? Is that could be a possible source of data?
Yes.
There was
So the first one that I put in the track is called My Tracking. That's where all of our data lives.
Okay.
And then there's a button, when you click it, there's a button that says Explore Data on the right. And then the research.
So do other people have questions in the comments as Spence gets that information into the chat?
Just one, if I may. I kind of sketchy in listening in, but is there any ongoing research in terms of
yes,
there is ongoing research?
Yes,
Yeah.
he had a slide on that
Okay.
information. I think he's putting in that information in the chat too.
Awesome.
Yes.
Thank you so much. Thank you.
Sarah, you have any comments? You work in a similar field in Indiana?
Somewhat related. I was just going to say, yeah, thanks. This is interesting. I work in stormwater, so water running off of the
Okay.
land and parking lots and roads and stuff. But
Okay.
it's all connected, and I just am curious. I just am interested in learning more about all water topics because I get random questions about things, and obviously all water is kind of connected, surface water and groundwater and, our drinking water and all that. So just very interesting. Thank you.
So does Indiana have a similar environmental health bureau, however it's called, that focuses on many of the things that Spence talked about?
I believe our health department, state health department, has some similar programs and things like that. And then I work more closely with my county health department. I'm a county employee, and so I work with them and try to promote some of the things that they're doing that are especially related to water and stuff. So we have some similar programs and similar and different challenges too.
Okay. Well, I do have to ask a chemistry type, science type question, which is, we talked about, I think, the way that you guys work, Spence, is to first identify, investigate, and then intervene, something like that?
Yes.
The first step is identify. So I am assuming that you guys are using different chemical identification techniques, methods, and instruments. Is that something you do in the state or in partnership with universities? How is that?
We do have partnerships with universities, but we also do it at the state. We have toxicologists and epidemiologists that work on the identifying part of the equation, that are state employees.
Okay. Okay. So you kind of do it in-house.
Yeah.
Okay. All right. Yeah, I'm definitely going to look up the Michigan Chemical Exposure Monitoring. That's also on your website, or I could just
Yes.
Google it and okay.
And I put the biomonitoring link in the chat.
Okay. All right. Very good.
How
So
big
this
is
was
Michigan?
Go ahead.
What's the size of Michigan?
That's a good question. It's big. Big state. I can't
Size of a mitt.
Huh?
Mitten. Size of a mitten. I don't know.
Size of a mitten. I don't know the square miles, but it's huge. It's really huge. I could try and quickly find out the square miles and stuff online, but yeah,
It's okay. It's just a thought.
yeah. Trinidad could fit into it maybe 100 times.
It's over 96,000 square miles.
Oh, okay. Okay. Yeah. It would take days to try to traverse the length and breadth of Michigan. And it's beautiful country. It's really beautiful country, actually, with the lakes and all of that. So, all right. Any other comments and questions or questions?
I have 6 pages, but I'll wait and speak with them later.
Okay. Yeah, this
one did
really...
has to do with, since you mentioned the lakes, so we are surrounded by bodies of water. Where do we find the data of how they're, the quality assurance, how they're actually monitoring who's dumping? Some companies can dump, some, how do we find out who's dumping and what they're dumping and who's monitoring that from the state?
That is a good question.
Yeah.
I am unsure about that data. I'm going to have to get back to you on that.
That's probably DNR, right? Maybe
I'm putting in my notes right now.
Yeah. It's a combination. One thing we don't have is good water quality data, but U.S. Geological Survey does all of the monitoring of all the streams in terms of flow. For example, there's a federal database called Storette. My experience with it is that not everything's in the same units, so you have to do some cleaning of the data. But I know that water, and you can see the permitted dischargers to water using something like EPA's My Environment.
Okay.
So there's some public databases that are still remaining. So you can see who are the dischargers that have permits to discharge to water. My Environment will also produce about 6 different maps. The one on the left is called My Map, and that is the most thorough. And you will get a drop down legend, and you can click for discharges to water, to air. You can click on brownfields, discharges to land. And these, when they say discharges, these are allowable amounts of toxic releases.
Okay.
But it's really hard to know exactly what's in the water. Eagle does fish tissue data every year. Sometimes that's a good surrogate for what's in the sediments, depending on, they usually go from the bottom up. But I have found, just, when I did my master's, it was very, very hard to get good water quality data.
Yeah, I think they also have, during the summer times, testing for the algae growth and stuff. Algae.
Yeah. Michigan, the states with farm chemical runoff.
Yeah.
Which is contributes, and so is Indiana. Right. On me, and then it goes out to Lake Erie in Indiana. So it creates all kinds of havoc with the algal blooms. But I bet Desmond, was it Anne St. Anand?
Yes. Right here in St. Joseph. I could reach out to her too. She'll probably be on top of that information.
Yeah.
That's her business. Yeah.
And there are volunteer water monitoring networks that EPA advocates for, where citizens check for some physical and chemical parameters and report those to EPA.
All right, very good. We are getting close to the top of the hour, 11 o'clock, and I think we had a really good presentation, really informative. I just don't know. How many people work in your department? That's a lot
Not
of
enough
projects, man. Wow, that's a lot of projects.
Yeah,
work.
not enough.
Yeah. So we want to thank you, Spence.
Can I just ask another quick question?
Sure.
What would happen if you published a kind of booklet as part of a project that said that 3,000 was equivalent to 3,100 people dumping raw sewage into that water, river water, and recommend that nobody bathed in it? Would there be any reaction to a comment like that published?
I would
Equivalent
suspect
to
so, yeah.
3,100 people. That was the quality that we got out of that particular river at that. It was the end of the dry season.
There will
dumping raw sewage in the water.
Yeah, there would be investigation. There would be somebody needs to be accountable. That's
Thank you.
the thing. Yeah.
That's what I wanted to hear. Thank you very much indeed.
Just briefly, I'm so glad when we have talks like this that we leave out being more educated, and actually by listening to him being inspired that there is an entity and a person and a group and a team that can help us in our own respective communities. So I hope the next step is exactly that, something action driven to help the state, to help us to become healthier individuals. As Desmond always says, the environment is personal. And so, Desmond, thank you for this. Thank you so much. And your host, gosh, she seems awesome. And your speaker was also awesome. So it's so good to leave out of these meetings by taking something with us that fuels us and inspires us and gives us what we need to make our own communities better. So thank all of you.
Ooh, that's a great closing. I don't need to say anything more, except if it's Friday. It's Environmental Fridays. It is personal. Thanks again to everyone. our
you,
guest
everyone.
speaker, our co-host, our audience, our persons who asked questions, made comments, gave suggestions. You guys were really awesome today. Thank you. Have a great weekend.
Thank you.
Thank you. Thank
Bye,
you.
everyone. Thank you so much.
Okay, bye-bye.